Welcome to this short video demonstrating epidural anaesthesia in the dog. Epidural anaesthesia provides optimal pain relief for surgery of the hind legs, such as cruciate ligament surgery or fracture repair. In dogs, an epidural injection is usually performed at the lumbosacral junction. You may recall the anatomy of the spinal cord in this area. The spinal cord itself usually ends at approximately L5, and the spinal nerves to the hind limbs and tail emerge as the cauda equina. These spinal nerves are blocked with an epidural anaesthetic to prevent transmission of pain sensation from receptors in the hind legs and tail to the brain. An epidural provides optimum pain relief during the perioperative period and can last for up to 24 hours depending on the drugs that have been used. The reference at the end of this video discusses the different drugs and doses further. When performing an epidural, the iliac crest serves as a useful landmark for the lumbosacral junction. To perform an epidural, aseptic technique is required, with clipping and surgical preparation of the injection site, isolation of the prepared area with a sterile drape, use of sterile surgical gloves, and use of drugs in single-use ampoules. A spinal needle with a short tip and a stylet is used rather than a conventional needle. With the 5-kilo dog in this video, I'm using a 22-gauge needle. Larger dogs may require a 20-gauge needle. I usually perform an epidural by palpating for the cranial tip of the iliac crest, moving to the midline and palpating for the depression that separates the 7th lumbar vertebra and the sacrum to locate the lumbosacral junction as shown here. Placing the dog in ventral recumbency with the hind limbs extended forward helps open up the lumbosacral space. The spinal needle is inserted through the skin and the stylet removed. A small amount of the anaesthetic solution is dripped into the end of the needle to form a meniscus. When the needle penetrates the epidural region, the negative pressure draws this fluid down the needle, as can be seen here in slow motion. This is a reliable indicator that the needle is located in the correct position. Disappears as we push it in. Yep. Ooh, sucked in. Once the needle is located correctly, the syringe with the anaesthetic is attached and its contents slowly injected over 30 to 60 seconds before the needle is removed. There should be no resistance felt as the anaesthetic is injected. If blood or CSF is apparent, the injection should be abandoned. Great, thanks. Side effects of an epidural include blockade of the autonomic nerves. The sympathetic nerves located in the thoracolumbar region may be affected by the anaesthetic, resulting in vasodilation and a consequent reduction in heart rate. This is a common finding. Intravenous fluids and monitoring of blood pressure are recommended for all epidurals. Blockade of the parasympathetic nerves in the sacral region may result in urinary retention, and the patient should be monitored for urination post-operatively. After surgery, the dog will be unsteady and weak on its hind feet until the effects of the anaesthetic has worn off. Care should be taken to ensure the dog does not stumble as it comes out of the cage post-surgery. Before performing an epidural, please read this reference, which goes into more detail regarding drugs, doses and side effects. It is always safest to perform this technique for the first time under the supervision of an experienced vet.